When we first started our journey with tick-borne illness, I was 100% focused on Lyme disease, right? Lyme gets all the headlines. It's got to be the biggest thing to worry about, right? Well, it wasn't long until I realized how much co-infections matter. And in my husband's case, a lot of the nastiest signs and symptoms came from Bartonella. So you might be surprised to find out that our second Lyme Warrior research interview is actually not about Lyme. But then again, if you've been in the Lyme space for a while, you probably understand, because Lyme and being a Lyme warrior is not just about Lyme. Typically, it's about co-infections and other immune assaults that can keep you from getting well. So for our second interview in the Lyme Warrior research series, I'm really excited to talk to Dr. Ed Breitschwerdt. He is one of the world's leading researchers in Bartonella, and the two of us talk about the symptoms, the test methods, the treatment methods, all the things that you're going to want to know if Bartonella is impacting your case. My name is Nicole Bell, and I am beyond excited to be on the campus of NC State University because I'm about to go talk to Dr. Ed Breitschwerdt, who is a professor of medicine and infectious disease at the veterinary college here. Ed is one of the world's leading experts on Bartonella and other vector-borne diseases, and we're going to go upstairs and talk to him about his research and what he's really hopeful about in the Bartonella space. Okay, so I am beyond excited to be here with Dr. Ed Breitschwerdt, who is one of the world-leading experts in Bartonella and is a founder of Galaxy Diagnostics. And I'm really excited to talk to you about your research today as part of this Lyme Warrior initiative to really highlight what's going on out there in terms of the research community and a lot of the wonderful advances that are occurring in the Lyme and co-infection space.
Thanks, Nicole. It's certainly a pleasure to be with you and have a discussion about Bartonella and other vector-borne diseases that are turning people's lives upside down.
Yeah, so you have been studying Bartonella since like the 1990s, and you've been doing vector-borne illness even longer than that. So can you tell us, why is Bartonella so difficult to detect? It's often called a stealth pathogen. What does that mean, and why is it so difficult to figure out if people are infected?
So, as you suggested, our research essentially started with rickettsia and Rocky Mountain spotted fever, and that was a good place to start because most rickettsial infections worldwide, of which there's many, many species, kind of like what's happened with Bartonella and Borrelia, where we have many more species than what we thought a few years ago, it's an acute infection. And it's a lot easier to understand or study an acute infection where a dog or a human is healthy, they get a tick, the tick transmits rickettsia, they get a fever, they get sick, and oftentimes with administration of a single antibiotic, doxycycline for instance, they're better in 24 to 48 hours or starting to become much, much better. In contrast, many of the other tick-borne illnesses, of which Bartonella has been the most challenging in our experience, are called stealth bacteria because they can fly under the radar. And by that we mean that they are extremely difficult to detect prior to antibiotics, so to make the diagnosis and appropriately treat the patient. And then they're really difficult to prove that you've eliminated the infection. And similar to, I think what we've learned about Borrelia burgdorferi, Bartonella, now good evidence in recent years, is involved in biofilms. Biofilms protect bacteria from antibiotics. And the other thing that makes Bartonella somewhat unique amongst the vector-borne organisms is the fact that it can infect so many cells in the body compared to rickettsia, Ehrlichia, Babesia, where it's only infecting one of our immune protective cells like a neutrophil or a monocyte, or in the case of Babesia, an erythrocyte. Bartonella literally can get into cells in the brain, cells in the vasculature, into erythrocytes, into immune protective cells, and that allows it to get many, many places in the body.
Yep. And they're often not free circulating in the blood, right? So if you're taking a diagnostic test that's obviously usually blood-based or serum-based, it might be more difficult to detect, correct?
Absolutely. And yeah, that's become an important focus of our research in recent years. We initially, like any other diagnostic attempt, would rather have a sample that is easy to collect, like blood or urine. What we have clearly found, and actually very early in our research, is Bartonella is in the blood, out of the blood, in the blood. And depending on the Bartonella species and the host immune response, that pattern's not predictable. So in the early infection, and probably one of the best established examples is what's called trench fever, or caused by Bartonella quintana, and that was called 5-day fever because in the early infection, it was a very predictable fever that would reoccur at 5-day intervals associated with the fluctuating bacteremia. Unfortunately, the longer you're infected, the less likely that there's a predictable pattern. So one of the things we developed and published a number of years ago is what we call a triple draw, essentially collecting 3 blood samples within a 7-day period, and we showed statistically that at least improves our ability to find it in the blood. But to your point, a tissue biopsy, particularly of a diseased tissue in a patient, is a much more sensitive place to look for this bacteria.
Okay. And so you are one of the founders of Galaxy Diagnostics, which really takes the technology you've developed here at NC State and makes it available commercially for people to get tested, both animals and humans. So what other technologies do you have at Galaxy that will help basically detect this stealth type of pathogen?
So a major focus at Galaxy has been enrichment, and that originated with patented research that was done here at North Carolina State University, here at the College of Veterinary Medicine. And our initial enrichment approach for Bartonella was to use an insect biochemical composition growth media rather than a mammalian growth media. And the reason we arrived at that solution was because Bartonellas were being transmitted by so many different vectors: lice, fleas, sandflies, evidence supporting tick transmission, mite transmission. And again, unlike other tick-borne diseases that are solely transmitted by a single tick or a single tick species, having Bartonella being vector transmitted by so many different ones was really complicated. So literally in a laboratory meeting that we would hold every week, we had this discussion that these bacteria seem to be happier in the insect biochemical composition than they are in the mammalian composition, because we were really struggling trying to prove that a dog, a cat, or a human was infected. So the first enrichment approach that we used was this Bartonella alpha proteobacteria growth medium to get the bacteria up to a level where we could amplify the DNA of the bacteria, specifically identify it, kind of like going to a crime scene and saying that you find DNA of this particular person. That gives the clinician that is trying to help the patient direct evidence of infection. And that's what, as an infectious disease researcher, I think is really, really critically important. It's great to look at host immune response. It's great to look at serology. It's important to try to culture organisms. But all these testing, including enrichment culture and PCR, have their limitations. And that's tough for a patient to understand. And it's even tough for clinicians to understand sometimes that our diagnostic tests are not perfect.
Well, and I think that's a great point because, chronic illness is very difficult to unpack in the first place. Then you have a pathogen that's really difficult to detect and people don't even really know when to screen for it. So I guess, you've been working on this pathogen for so long. What are the top clinical signs that you look for, whether it's in animals or, or just your experience with humans, that would say, hey, you should probably test for Bartonella and see if it's available?
So Nicole, that's absolutely a great question. And one of the things that, I learned in the context of being a clinician and infectious disease diagnosis is that whether it's human medicine or veterinary medicine, we use pattern recognition. Mm-hmm. And pattern recognition is great if there is a very specific pattern associated with the infection. And I preface that because with Bartonella, the patterns are not as clear. Bartonella is now the number one cause of culture-negative endocarditis in humans. It's the number one cause of culture-negative endocarditis in dogs. And so one thing that, in regard to a person that develops an acute onset of a heart murmur, is feeling terrible, lethargic, and goes to the doctor and now has a murmur and never has it before, then endocarditis is going to become a top differential, and routine blood cultures are performed. If they're negative, that ends up being endocarditis. What our research and other researchers have shown in regard to Bartonella is that it can affect any system in the body, and likely every system in the body, and it does that intermittently and periodically over long periods of time. So my bias at this point, based on almost 25 years of research trying to understand this bacteria, is the good news is Bartonella doesn't want to kill anyone. It wants to maintain the host that it lives in until another vector comes along to pick it up to get it into another host. So from that standpoint, we could say on an evolutionary basis, it's a very smart and very educated organism. It's also very smart and very educated because it can get into a lot of different cells. So the major symptomatology relates to the nervous system, the rheumatologic system, essentially the muscles and the skeletal system, and the cardiovascular system. So it causes endocarditis, it causes myocarditis. In regard to the nervous system, it has caused everything from transverse myelitis, essentially paralysis of your legs perhaps, where the upper body is not affected, to cerebral vasculitis, essentially in the brain, a lesion due to the localization of the Bartonella in that area. And the rheumatologic manifestations, I think ultimately we will be able to show that Bartonella is one infectious cause contributing to rheumatoid arthritis.
So one thing that I've been fascinated by with Bartonella is also some of the linkages that you and your team have uncovered to mental illness. And this is something that I lived a slice of with my husband. He had massive bouts of depression and anxiety, and he had multiple infections, so it's difficult to really say, but when he was treated for Bartonella, all of these symptoms flared, and it was really gave me a healthy respect for the impact of this organism on the human body. And so maybe talk a little bit about the linkage that you're seeing in the research and with to mental illness and other types of states.
So the way, again, I'm a veterinary internist, as you stated, and I've focused on vector-borne infections and their diagnosis and treatment in dogs, and to an extent those that are zoonotic and affect humans. The progression in our research was essentially to understand Bartonella and cat scratch disease, which can have neurological complications in a small subset of people. We then went on to find the first Bartonella to infect a dog, and that became a new Bartonella species. And then again, because of veterinary medicine being responsible for kind of all the animals on the planet, we had literally looked at marine mammals, horses, cows, sheep, and other animals over time. But as a clinician, my patients are cats or dogs. Mm-hmm. And so as I started looking at what we were seeing in cats and dogs and relating that to veterinarians at national and international meetings, they would come up, and that became our study population. And it's obvious that we've done 3 studies, 2 in the United States and 1 in Spain, that veterinarians are occupationally at risk of acquiring this infection. And my bias is that, veterinary medicine will become the canaries in the coal mine by which human medicine will better understand the medical implications of this genus. So then we started seeing veterinarians that we could find specific Bartonella species that had primarily neurological presentations. And that's how it started. After that, and after publishing those case reports or case series, I would get phone calls oftentimes or emails many times from mothers. And one of the things that I came to appreciate is a mother with a child or a family member that is chronically ill with any type of disease process is going to be on the internet until she's turned every stone over possible. And so, then we started looking at non-veterinarians, and some of these individuals ended up being, young girls that were absolutely normal, and then, started having behavioral changes and hallucinations or seizures or other abnormalities. So, again, our publications haven't been highly sophisticated. They've been case-based or case series-based, but they have been strongly microbiologically supported because we could find Bartonella in the blood, and when these people were treated, they would recover from their neurological illnesses.
Yeah, and I've seen that anecdotally as well. I mean, with my husband and other patients that I've talked to that have said when they specifically treated for Bartonella, they could feel that the anxiety, the audio hallucinations and visual hallucinations and other things that either got exacerbated and then went away after treatment, or that they could just tell was linked because of where they were in their treatment. And so anecdotally, I think that evidence is starting to mount, and so I look forward to future research that hopefully can help a lot of people that are very ill.
Absolutely, and we do as well. Fortunately, and primarily through funding from the Cohen Foundation, we have been able to build my team here on a research basis at NC State to purchase some highly sophisticated equipment that again allows us to detect Bartonella DNA and other vector-borne organisms in patient samples in a much more sensitive way than we could just 3 years ago. So there is progress being made, and for both patients and those of us doing the research, it's not fast enough, but there is substantial progress being made worldwide in regard to trying to address these infections that we consider stealth infections.
Yeah, I think that's great news. And I think the other piece of news that people want to hear, if one, you find out that you're infected, but now what do I do about it? So I know you don't treat humans, but you regularly treat animals that are infected with Bartonella. So what treatments have you seen be the most effective, and what makes you hopeful that this is something that once we know it's there, we can test it? And then I guess the corollary question is with a stealth infection, how do you ever know it's gone, because it's so difficult to detect in the first place?
Those are all very good, very important, and very incompletely understood questions at this point in time. I think in regard to treatment, one thing you alluded to earlier from your personal experience that has become very obvious is this Jarisch Herxheimer reaction that was initially identified when penicillin was administered for syphilis. And then researchers correlated that with Borrelia infections, relapsing fever, Borrelia burgdorferi, and we clearly see that in association with Bartonella, both in humans and in animals. And I think the important part of that for clinicians is that anytime you start an antibiotic and all of a sudden your patient is a whole lot worse than when you started the antibiotic, the tendency is to stop the antibiotics, change the antibiotics. And if we know this occurs, and it needs to be characterized better on a immunological basis, because that has been done with some of the other infectious diseases, then at least we would know not to stop the therapy and to try to suppress the symptoms during that period where that Jarisch Herxheimer reaction is occurring. The good news is that most people infected with Bartonella likely clear the infection themselves. That's the good news. The bad news is that some people, including those that are scratched by a cat and get classical cat scratch disease, which is essentially a fever, lymphadenopathy, and a history of a cat scratch, do not clear the infection. And again, we've proven that in publications where someone had classical cat scratch disease and 2 years later they're seizuring and we grow Bartonella out of their blood. The treatment for most people, at least early in infection, is successful. In animals, I would never treat Bartonella with a single antibiotic. So if it's an established infection, and again, being an internist, everything I see is chronic. So most infections by the time they would get to me would be established infections. So our tendency would be to treat with 2 antibiotics and to treat for a fairly long duration compared to many of the other vector-borne organisms that we would treat for.
What type of duration would that be generally for an animal?
For an animal, it's a minimum of 6 weeks.
Okay.
And so then we get into, I think, what you're really asking me about, and that's the fact that some people do not clear this infection, and they do not clear it with 2 antibiotics, and they do not clear it if those 2 antibiotics are administered for months. And due to the fact that it's so hard to culture this bacteria and obtain isolates that we can characterize, has the bacteria become resistant, or is the problem immunologically with the patient that they're not able to clear the infection? We really don't have good answers to a whole lot of those questions at this point in time. There are clearly some individuals that do not clear this infection, and it's one of the reasons, again, the Cohen Foundation has funded diagnostic work here at the college. They've also funded a consortium that consists of NC State, Duke University, and Tulane University. And the 3 medical colleges are going together to try to come up with a drug that specifically targets Bartonella.
Yeah, that's great. And I think that leads right into what I would want to ask about next is, you've been doing this research for quite some time. What are the things that you're the most excited about? If you want to provide some hope for people that are, treating this infection on a daily basis, what are the things that you think are kind of on the horizon that say, hey, we are going to get to these answers and figure out how to help people?
Well, I think the most important thing that I'm excited about is I've literally prayed for a tipping point for the genus Bartonella in the context of medical importance for almost a decade. And at times it's been very lonely being a veterinary internist, suggesting to my physician colleagues that Houston, we may have a problem and that we need to better understand this problem and clarify the problem. So one, I'm clearly encouraged by efforts in our laboratory and others to improve diagnostics because, as a clinician, I've always believed the kindest form of therapy is an accurate diagnosis. If at least I know what the target is, I know what direction the therapy should actually go. The second, so I think we've reached the tipping point, and I think it's well recognized now that this is a genus of bacteria that deserves funding at the national and international level to better understand its importance as a stealth pathogen, and more importantly, as a contributor to chronic illness. And then I'm optimistic, at least, there's many laboratories looking at better treatments for Bartonella and taking different approaches from combinations of antibiotics to new antibiotics to old antibiotics that haven't been looked at to nutraceuticals. And I think the other thing I've learned from my physician colleagues is that for this infection, the antibiotic is not the solution. For this infection, addressing every aspect of the immune system, the endocrine system, the stress in a person's life, their overall health is critical. And I've actually taken those concepts that I've learned at lectures and brought them back and approached my animal patients differently as a result of that.
Yeah, and I think that's a theme for a lot of tick-borne illnesses is the stronger your immune system is, the more likely you are to clear the infection and to get well. And so it's a critical part of the strategy. Although, antibiotics also can be a good thing to kind of push you over the edge if you need that. So, Well, I really appreciate you taking the time to speak with us today. I mean, this has been a great education, and I think that your work to elevate Bartonella in the community and have people understand its linkages to all sorts of different types of chronic illness has been absolutely essential, and really I applaud you for the pioneer that you've been within the space.
Thanks, Nicole.
All right.
I appreciate your time.
All right, thank you so much.